All right. Well, again, thank you for joining us tonight, and we will be speaking about vitamin D and your health. And pretty much, I'm just going to hand this over to Dr. Elizabeth, who, again, like I said, has done some excellent presentations for us. And she's going to kind of like give you a brief background about herself. But in the middle of the presentation, Dr. Joe will be on to talk about how he has used vitamin D in his practice. So this is going to be, again, a very, very power-packed presentation. So I'm going to hand this back to Dr. Elizabeth. Dr. Elizabeth, thank you so much again for joining us.
Okay, stay handy for me just a second, David. When you hand it over, I just want to be sure that we're looking okay. I've got to shrink
Okay.
this and expand this, and we should be ready to go. Okay, does that look okay?
Yes, if you would, yeah, exactly. That's great. That's good.
Okay, great. You know, everything you ever wanted to know about vitamin D. It may sound like a bold topic, but I've had a lot of help. I've learned a lot, of course, from Dr. Joe. I'll be introducing him in just a minute to help us cover some of the uses in clinical practice. But off we go, vitamin D. I want to share some resources with you at first. Almost everything that I say will be found in one way or another on a website called vitamindcouncil.com, vitamindcouncil.com. And these are the experts in vitamin D who have reviewed the entire world literature on vitamin D, every form of vitamin D, in every language it was published, so far as I can tell, to help us understand what the current up-to-date information on vitamin D is. I graduated medical school in 1991. My nutrition information was let's say weak, and none of us took it very seriously anyway because we didn't have to write prescriptions for nutritional products. We just didn't take it seriously. We didn't think it had that much value. I've since learned the overwhelming and outstanding value of appropriate nutrition in optimizing systems, and that's sort of the shift of where doctors are looking today. I think forward-thinking physicians are looking not at find a disease, treat a disease, but in optimizing the entire system. And nutritional elements are absolutely the foundation of where we're going to go with that. These people who have put together the vitamindcouncil.com website are not selling anything. All they want to do is get the correct information out there because there's a lot of, there are myths and superstitions and misinformation, and they're just trying to shake the cobwebs out of our brain. So if you only write down one thing the entire evening, write that down, vitamindcouncil.com. Off we go. History of vitamin D. We know that rickets is the disease of vitamin D deficiency, and they knew for years that sunlight and fresh air seemed to prevent rickets. They didn't know if it was the fresh air or the sunlight or what. At one point in the early 20th century, an anti-rickettic factor was identified in butterfat, and since vitamins A, B, and C had already been taken up, when the actual chemical structure was elucidated, Adolf Windhaus won the Nobel Prize in 1928 for its discovery. So much research has been done in vitamin D in the last 10, 15 years. It may be the only nutrient that actually wins the Nobel Prize twice. It wouldn't be a talk on vitamin D without a few pictures of rickets. Unfortunately, vitamin D is so important to bone health. We see that if there's not enough vitamin D, the bones can be extremely deformed. This is a very painful condition, and on the side here with the little baby is what's called a rickettic rosary. These little beads or bumps is a painful condition where the bones are just growing abnormally because there's not enough vitamin D there. So what's in a name? We call it vitamin D, but the truth is a vitamin is a nutrient which is not synthesized in sufficient quantities by the body. It has to be obtained in the diet. Well, we'll learn later that's not true at all about vitamin D. It is synthesized in the body and is very difficult to obtain in the diet. But we learn a little bit more about vitamin D. It's actually closer to a hormone, which is a chemical released in one part of the body which affects cells locally and all over the body. A good example is actually insulin. It's released from the pancreas and affects what goes on all over the body. Another example would be testosterone, which again affects things all over the body, brain and everything else. The real identity of vitamin D is actually a prohormone. In other words, it's converted into a hormone in the body. It has actually endocrine properties. It's in what happens in the kidney that helps regulate the calcium would be an endocrine example. It's got paracrine examples, which is it's secreted by a cell or a group of cells and affects tissues around it, and also autocrine. It's actually converted, made active by cells, and affects what goes on in those cells themselves. So people ask, we've got D1 and D2 and D3, D what? I remember as my grandfather used to say, do what? There are 5 subclasses of vitamin D. D2 is a supplement you can take. It's artificial. I don't recommend it. Unfortunately, it's what you will get if you ask your doctor for a prescription, most likely. And it's from irradiated mushrooms or irradiated yeast. You can irradiate almost any vegetable matter, actually, as it turns out, and it will have some vitamin D effect. But in the body, it may make metabolites that your body doesn't really know what to do with. That's why I don't recommend it. Vitamin D3, on the other hand, is natural. That's what's made in your skin. You can get it from cod liver oil. It can be extracted from wool or other sources. We'll get to some of the food sources in a second. Ds 1, 4, and 5 are actually artificial or some biologic intermediates. If I say vitamin D today, I'm talking about vitamin D3. What does vitamin D do in the body? A lot. Its most important role is to maintain calcium levels. It's also important for bone strength, muscle strength. It regulates, we know for a fact that it regulates the expression of 200 genes. That's 1% of the human genome, and it's estimated that it regulates the expression of up to 2,000 genes. So that's up to 10% of the genes in the human genome. Now, to me, this is neat. I mean, we could go into a whole diverge into epigenetics, but this is really cool. We know all the genes in the human body. There aren't nearly as many as we thought. And what's much more important than what your genes are is how are your cells expressing those genes. And that is what's affected. That's called epigenetics, what is controlling the expression of those genes. And that's influenced by every thought that you think, everything that you're eating or not eating, everything you're exposing yourself to, perhaps even, the radiation from my Wi-Fi or my computer sitting in my lap right now. All of these things may have an effect on that. But the fact that vitamin D, that is the one substance that we know may affect up to 10% of the expression of the genes. It's extremely important. Vitamin D is important in immune function, both in keeping the body from reacting against itself in autoimmune diseases, as well as making sure that the immune system is functioning properly to fight off invaders. It's important in regulating cell proliferation. That means the cells, we need cells to divide sometimes. They get old and worn out. We need new ones. But we need the old ones to die, and we need the new ones to stop proliferating when we have enough. If we have too much proliferation, or they're not differentiating and they're not becoming the proper cell, we lose the programmed cell death, for example. That's a condition called cancer. And vitamin D is absolutely mandatory in regulating all these functions. It also prevents, big long word, I'm sorry, $10 word, angioneogenesis. What this is, that says in cancer cells, things are growing very, very quickly. And somehow you have to get the nutrients to all those cells. So they need bigger blood vessels and they need more of them. Vitamin D blocks that. So all these things are extremely important. There are cofactors that you need to go with vitamin D. Now, I didn't make up this list. This is actually from Dr. Cannell, one of the vitamin D experts. You can get this right off the vitamindcouncil.com website if you can't keep up with me. Number one is magnesium. We know is the commonest mineral deficiency. 60% of the people walking around outside don't get enough magnesium in their diet. It's very prevalent in green leafy vegetables and nuts and seeds. Most of us don't eat those. And if I go to my local emergency room and just take a blood sample of everybody, probably 80% of them will be deficient in magnesium. I know that. And if I go to the ICU, closer to 100%, when they roll through the door will be magnesium deficient, and hopefully they'll have some ICU docs that are checking on those levels and normalizing them. Magnesium is a cofactor, not just for vitamin D, it's a cofactor for almost every enzyme reaction in your body, and the fact that most of us walk around with low levels is pretty sad. It's going to be associated with muscle cramps from time to time. I bring this up. When people begin taking vitamin D, they may have some muscle cramps, or things aren't feeling well, and what may have happened is there's a calcium and magnesium imbalance now, and it's unmasked this magnesium deficiency. So if you run into somebody who's trying to take their vitamin D and they're running into trouble, just make sure they're getting the magnesium too. And it doesn't matter how they get it. And people will try and tell you you have to get this kind because it's bioavailable and better absorbed. Even dumb old magnesium oxide works. So just get it in your body. Other cofactors, zinc, boron, vitamin K2. Probably could spend an hour on vitamin K. But just so you know, vitamin D and K work together to keep the calcium in the bones and out of the blood vessels. Someone once said old age is a situation where the calcium comes out of your bone and goes into your blood vessels, and that, we call it hardening of the arteries, or you can get your cardiac calcium score. Vitamin K and vitamin D work together to keep that calcium where it belongs. Also genistein and isoflavone and small amounts of vitamin A. It's becoming more and more clear that vitamin A and D can antagonize one another, and it doesn't seem to be a direct effect. I suspect what's going on is vitamin A is it's a teratogen. If I give vitamin A to a pregnant animal, it will have birth defects. The offspring will have birth defects. It's a teratogen. Beta-carotene is a much safer supplement because your body only converts as much as it needs into vitamin A. Beta-carotene is an antioxidant anyway. Vitamin A is not. So small amounts of vitamin A are good. How small is small? I don't know that we know that answer yet. But beta-carotene is always safer. Off we go. What is low vitamin D associated with? A whole host of things. We've got everything from osteoporosis, which we expect, but cardiovascular disease has a phenomenal association with low vitamin D levels. Insulin resistance and beta cell dysfunction. I'm talking about type 2 diabetes and the metabolic syndrome. And these are not just associations. There is a causative association here as well. Multiple cancers associated with low vitamin D, and autoimmune diseases. Many people may not realize this. Type 1 diabetes is an autoimmune disease. The body actually attacks the beta cells in the pancreas, and they die off. Not all of them, but most of them die off. Also multiple sclerosis, rheumatoid arthritis. There's a longer list I'll go through later. There are some people, we know most of us are actually vitamin D deficient. We could go through the stats, but it's a friend in Gainesville, Florida had to check 70 vitamin D levels before he found one that was normal. In Toronto, it's well over 90%. It's safest to assume that we're vitamin D deficient. The severe deficiencies you're going to find in people who are institutionalized. They're inside all day. People who avoid the sun, and there are 1,000 reasons to avoid the sun. There's a risk of skin cancer. We're worried about wrinkles. Those of us who are vain, worried about wrinkles or freckles. So people that are in hiding, refugees, celiac disease, or may have some other malabsorption syndromes. Regional, the further north you go, or at lower altitudes, so people in the valleys are going to be more likely to have severe deficiencies. If someone already has osteoporosis or rickets, we already know they're severely vitamin D deficient. And pregnant women, the baby needs a certain amount. Most of the moms are actually vitamin D deficient anyway. If they've got dark skin, so they're not able to make a lot of vitamin D, or they're wearing veils, as you mentioned, David, they're in equatorial Africa wearing veils. They're having vitamin D deficiency and rickets there. How is vitamin D synthesized? Well, there's this, another long word. It's a cholesterol derivative in the skin called 7-dehydrocholesterol. UVB rays hit it, and it's turned into cholecalciferol, or vitamin D3, in the skin. Now, I have to tell you, UVA breaks down the precursor, so those of you who are sitting in a sunny window are only getting UVA, and so you're not going to be making any vitamin D there. You have to be outside in the sunlight. And it's important to understand for every system in the body, there's a natural system of building things up and breaking things down, and this happens in the skin as well. From the skin, it goes to the liver, where there's storage form is made. That's the 25-hydroxy vitamin D3. Big, long word. Let's call it calcidiol. It's also easier for me to type. And the active form is made in the kidneys. From there, 125-hydroxy vitamin D3, or calcitriol. Calcidiol, or the storage form, well, remember, again, made in the liver. This is what fills the vitamin D tank. And we now know this is what we need to check when we're trying to determine somebody's vitamin D level or their vitamin D status. We want to check this. We've been checking the wrong lab for years now and probably doing people a grave disservice. There are two possibilities from the liver. Where's it going to go? Either the kidneys or the body. Calcitriol is what's made in the kidneys. That's the active form. And that's the most important thing that happens with vitamin D. And that's what maintains our calcium levels. It's possible to die from having too low a calcium level. It's really hard to do because the systems in your body, several systems in your body, are geared towards maintaining those calcium levels. but it's extremely important. Now, you also have to understand calcitriol is actually the most potent steroid hormone in the body. It's active at 1/1000th of a gram. This is neat. So if you take 2 Tylenol, you've got about 1 gram. If you take, and those are like 1,000 milligrams each, right? Some of you may be on a thyroid supplement. You may be taking 88 micrograms. That's actually 1/1000th of a gram. And 1/1000th of a gram, or a nanogram, is how active this steroid hormone is. Extremely active stuff. Now, more on calcitriol. The calcidiol, the storage form that's not used in the kidney, goes to the tissues. What tissues? Almost every tissue in the body. And those tissues get to use it, and they get to make their own calcitriol. The job of that calcitriol is not to maintain the calcium level. It's to do a whole bunch of other things. Remember when I talked about turning on and off genes and regulating cell differentiation and cell proliferation and all the immune system? All that is local calcitriol made in the tissues. And we talked about regulating the genome, yes. So where do we get our vitamin D? Well, you can get it from the sunlight. Remember, it's only UVB. And we don't know how long it actually stays in your skin. There's some evidence that if you go take a shower right after you've been sunbathing, you may lose some of it. So you can also take supplements, or you can get some from food, which is a really poor choice. This is really not a good thing to find in the diet. Milk, at the very best, has 100 units in every glass. And I say at the very best because anytime the Consumer Reports or anybody else goes testing the vitamin D level in the milk, they find that it's almost never what it says on the label. Remember, it's fat soluble, so if you've got skim milk, it probably doesn't have any there. Cod liver oil is another choice. You'll get 400 international units per teaspoon, but you'll get way too much vitamin A by the time you get the vitamin D that you need. And this is the kind of family I come from. My brother and I did the math one evening in the kitchen, and my parents, 1 can of salmon will get you 2,000 international units. In other words, it's really hard to get enough from food. I wouldn't waste much time on that. Okay. So how much can we make in our skin? If you have a fair-skinned person, it's the middle of summer, they've got lots of skin exposed, you know, Speedos, bikini, whatever, they may make 20,000, possibly up to 50,000 international units in less than 30 minutes in their skin. There's something called the minimal erythema dose. Your skin gets just a little bit pink, not sunburned, just a little bit pink. But you make less if you're dark-skinned, if you're wearing sunblock, if it's fall, if it's winter. When we reach the age of 55, the skin is not as efficient in making that conversion. And if we're obese, we're not going to make as much either, which unfortunately most of us are. So how much sunlight? The experts say, oh, this is great, it's easy, 10 to 15 minutes. Okay, sorry, not the experts, but some people who say they're experts. 10 to 15 minutes a day with exposed hands, face, and arms if you live in the tropics. Just one problem, we don't live there. We know it's impossible to make any vitamin D at all during the fall and winter north of 35 degrees latitude. And I'll show you that math in just a second. And it's almost impossible in the summer at extremes of latitude. If you're spending your summers in Alaska and your winters in Phoenix, Arizona, you're probably vitamin D deficient. Let's take a look. 35 degrees latitude, you'll see it's right there at the top of Alabama. All the way across through the middle, that's about Little Rock, right there in the middle of the country there, slices off the top of Texas. And it's just north of Phoenix, and this little spot on California is right about Santa Barbara. So you see, most of the nation is in a place where they're not going to make any in the winter, and it's going to be hard in the summer. Most of us work, we're indoors, so we're left with supplementation. How much vitamin D should I be taking? Well, there are 3 approaches. One approach would be take a certain small amount every day that has some demonstrated benefit in preventing diseases or preventing complications of diseases or complications of vitamin D deficiency, and relatively little to no risk for healthy people. And that number might be anywhere from 1,000 units a day to 10,000 units a day. We know that we've never found toxicity with people taking 10,000 units a day or less. Another approach would be to check a blood level of that storage form, that calcidiol, 25-hydroxy vitamin D, and maintain that with frequent testing, whatever it takes to get there, and then maintain it, and check frequently. And that's actually currently the expert recommendations at the Vitamin D Council. Another approach would be to take very large amounts every day and don't sweat the blood levels. And to help us understand how that may be beneficial and to share some clinical experience, I'd like to introduce a special guest to me, Dr. Joe Prendergast. He's the founder of the Endocrine Metabolic Medical Center, board certified in internal medicine as well as endocrinology and metabolism. Well published in the medical literature. It's a much too long list to read. And author of The Uncommon Doctor. Dr. Joe, are you there?
I am, and thank you for having me here.
Wonderful. Just share with us, if you don't mind, you've been giving people how much vitamin D?
Well, I varied a lot because I began in 1964 when I saw my first patient as I was becoming an endocrinologist, and it was wonderful that my chief was actually the chief of endocrinology for Henry Ford Hospital. And I made the diagnosis in a 65-year-old woman of rickets. Well, that's osteomalacia when you get to be old. You've got to change names of it. And, and he said, well, what are you going to treat her with? And I said, I don't know. No one ever told me, and I've never seen a case before. He said, well, it's 50,000 units a day. You've got to do a lot of it, and you've got to keep it up for a long period of time. Well, that was my first instruction. And with that, I began to feel and figure out that a lot of the internal medicine and endocrine people didn't really know how to do this. And I began to work with my own patients as I moved out of the academic world and moved into my private situation. And putting electronic records in long ago, we were able to follow a lot of our own little studies, if you will, and to be able to get into a situation where everything would be quite a bit better. We've got to get the other phone out of our ear here. The whole thing enabled me to put some things in action. About the year 2000, I was able to do some testing on a series of women who had just delivered their first child in their mid-30s, and they were upset about their metabolism after that. They'd all been wonderfully exercising, doing all the other things, would do whatever you wanted to do, but could not get over their weight gain that they've had. So what they ended up doing is saying, you know, I've got something different, and the only thing you've measured is my low vitamin D. And I said, yes, that's true. And they said, well, we'd like to do this. And there were 12 of them. And every month we checked their vitamin D as they took 50,000 units a day. So as I watched this go up, I could see it went up every month on a steady basis. They were below 50 at that particular time. I don't know all the data. But as they were in that situation, they got up to about 200 days, roughly 6 months. And at that point, that's when they peaked on their vitamin D. And what were the values? They ranged between 800 international units, we'll go with that for general understanding what's there, between 800 and 1,200 units. So each day, as I would talk to them once a month, I would ask them all, are you sick? Do you think you're toxic? Are you doing anything wrong that we should stop or check other things? And most of them were all saying, I feel better, better, better. Well, we got up to the 200 level, and then they were at a point where they began to go down. They consistently had less vitamin D than before. And they want to know why. Well, I still don't know why. There's some sort of situation where they either don't absorb it, increase metabolism, do something else that actually makes the body only take in that amount. And we had a lot of people who had various cancers that we'd use this dose on. So that I felt very comfortable over a long period of time, and I felt this is very good. And after that, I really didn't check any blood levels at all. I love the Vitamin D Council. I love all the people there. I'm good friends with all the people they talk about at Harvard and other places in the world doing research on vitamin D. I've known most of them for 40 years. That's a long time. Wow. So when we have talked about these situations, I realize that nobody in the modern era goes into that situation. And I have to go back to the early part of the 20th century when the Germans were taking care of TB, and they were using 50,000 units a day, 100,000 units a day, 300,000 units a day for about 3 months. And then they changed various things. And most of those papers, though, have been lost. They've been referred to. So as Dr. Owings was saying, we're in a funny patch right now. For something that's been around over a century, we know very little about it. And we're trying to learn more about it all the time. When I had done this, I felt, again, comfortable with what I was doing. But we have new situations that I didn't like. When we are using large amounts of vitamin D, if you get sick, if you go to some place where they're serving a lot of calcium and something that you don't know that it's in there, you'll find that your body reacts differently to this. The calcium goes up, people feel a little funny, and a variety of other things. So I began to look around saying, what's safer? If it's cancer, we'll watch closely and know what's going on. But otherwise, let's figure out what differences that we can use. And we do know that as high as 20,000 units a day, and this is again from the Vitamin D Council, is no big problem, because at that point, no one has ever recorded a certain toxicity. Now, having said that, there are probably 50 people on the line who say, well, wait a minute. But that's in general something that people think might be very safe. Well, is that safe to prevent cancer? Well, we don't know. So when we got into this thing a few years ago, I recalled back in 1970 when I was at the University of California, San Francisco, and I found that we were trying to help people that the surgeons had done gastric bypasses on for weight loss. What we found is that about a third of the time, with only about a foot of their absorbing capacity left in the bowel, which was what they had to do to get the weight loss, but that was not enough to get a lot of vitamin D in anybody. And we saw a very large number of people, about, again, a third of them, who actually died because we could not get enough vitamin D, even though they rehooked up the surgery and everything else. That was a very bad place as far as I was concerned. And that's where a friend of mine and I began to think about doing it in some other way. We couldn't give it IV, intramuscular, anyway, and said, how about in the mouth? How about inhaling a spray in the mouth? People had tried it with liquid, and it's actually, there are places today where you can get the liquid D, but they don't go in any better than if you have a capsule. So about 3 years ago, we invented this spray that is a water-soluble spray, and in about 15 seconds, with 8 sprays, you can be at 5,000 units of vitamin D. It's efficient, it's quick. We get results in, like cancer patients, that we used to just dream of. It's fast. So I have sort of shifted over to that as my primary thing that I'm doing with reference to that. We sell it basically out of the office. We're not really promoting it in any great degree, but just this past week, the Vitamin D Council said, hey, we want all the stuff that you have about this. This is very interesting, and we like to think about, as we recommend other things are going, that we might want to recommend that particular product. We'll see. We're all learning all we can about this. Boy, it takes a long time, though. But the rest of things that you got in here, Elizabeth Owings, is so good. This collection of slides are just astounding. I don't think I've ever seen anybody put a review like this together. My hat's off to you. This is
oh, wow. I wanted you to just touch on one more thing, because you've actually read the paper and I haven't, or you've reviewed the data and I haven't. I wanted to save it as a punchline, but I know you're short on time, and it's just so astounding, and it's been everyone that I've mentioned it to, that their jaw is dropped that this was even possible. But would you share the information that was supposed to be published in one of the journals? You said it hasn't come out yet. Could you share that information?
Oh, yeah. We had known, and this is part of what was observed, and the patients would tell us about this, and that's why we did it. This is the second study that's been known to do this, and it's putting people on 50,000 units of vitamin D a day, and watching how it affects the genitalia. And I can tell you that it's very hard to measure changes in the vaginal size. There are no good ways to do this, but the labia around the vagina does increase. And again, that's right now there's no acceptable mechanism to figure out how it changes in women. But many women we've done this with will say quietly to me, is this normal? And I said, that's part of it. It's a little disconcerting to act like and feel like I'm 16 years old again, but that's part of the side effects of the vitamin D. The men, the repeat study, the first one I knew about years ago, said there was a 10% increase in the penis. There was a 10% increase in the length and a 10% increase in the caliber. And this was reaffirmed, but it's now not the 10%, it's the 10.4%. So a little increase. Maybe it's a different D, I don't know. But that
it just gets better all the time.
Yeah, if you work longer, there it goes. But it is, and it is something that, as you were saying in a lot of the journals, we thought about publishing it. It's very interesting things are in some of these journals. But
that's true.
I hope this will be one.
Oh, absolutely.
I'm sorry that I have another thing that I must go and do now, but I greatly appreciate the time to spend with you anytime, and certainly to look over what you put here tonight. It's wonderful.
Thank you so much, Dr. Joe. We really appreciate your time.
Well, the best of everything to everybody who's listening in, and if there's other questions they later tell you, we can talk again.
Thank you so much.
Okay.
Good night. Okay.
Good night.
Off we go. So then you have to ask the question, if you're going to take 50,000 units a day, well, that's your choice. We know an endocrinologist who can monitor that for you. But if you're going to do what the Vitamin D Council experts are recommending and say, hey, let's get to a good level and just maintain that, you have to ask, what's a good level? It is hotly debated. And the first thing you have to ask is, well, what's normal versus what's optimal? The normal answers that the lab comes up with are determined by a population sampling. If we know that all of those are already suboptimal, then the question really becomes, what's optimal? What is the best vitamin D level to have? We don't have the answer to that yet, but I can give you some general ideas. And I know some of our guests may be in Britain or in Australia, so I've included metric numbers as well. In the American system, the lower limit most of the labs are now reporting is 32 nanograms per milliliter, which in the metric system is 80 nanomoles per liter. The experts are recommending 40 to 70, which is 100 to 175, or depending on the scenario or depending on the expert, many physicians practicing are very comfortable now watching levels at 50 to 100, which is 125 to 250. The experts, again, in the Vitamin D Council are recommending if you have a disease that we know is associated with low vitamin D, then you need to have a little bit higher level. And they're recommending 55 to 70. But again, I know many physicians that are at that point would say, well, you need your level greater than 80. So those are things to look at. And you have to ask yourself, well, says who? Who gets to decide what the best level is? And since there are building up and breakdown levels, systems in the skin where the vitamin D is made, then why don't we just look at the people who's getting the most sun-drenched populations, lifeguards. There's a study also on Puerto Rican farmers. You know, when we're sampling people who are outdoors all the time in the lowest latitudes near the equator, we find that levels are going up to 50. And that's by the end of summer, but what we find is by the end of spring, they're down to 30. And that 30, that number is now considered really not an optimal level for vitamin D. So we're back to the question of how much do we take. There are many different recommendations out there. The RDA is considered by all thinking humans to be woefully inadequate, 200, 400, or 600 international units. It's astounding to me that you can even get a study past an institutional review board that only includes 600 units, but there was one just published a couple of months ago where they were using 400 units, and they couldn't see any effect at all and concluded that vitamin D, at least at those doses, didn't give the effect that they imagined. Anyway, we know that your body uses, and these data are well worked out, your body uses 4,000 to 5,000 units a day from all sources, whether it's the skin or supplements or anything else, that's how much you use up. Lactating women are going to use up to 7,000 international units a day. We know when we look at levels, people's levels, there is no storage until the levels get above 40. And there's never been any documented toxicity at all at people who are taking 10,000 units a day. For people, children under 10 years of age, 2,000 international units a day is a very safe recommendation. Again, this is all on the Vitamin D Council website. So when they're working things out and you decide someone is low and we want to work out how much to give them to get them up, we know that 1,000 units a day yields about a 10 nanogram per milliliter elevation over 3 to 4 months, but only at low starting levels. I mean very low starting levels, like 8 or 10. I mean really low. When you're already up to 25, it may not give you quite the same results. Assuming people getting very little sunlight, it's very safe to give 1,000 units a day for every 15 kilograms of body weight, or about 3,000 units per 100 pounds. Those are very, very safe recommendations. Remember, less than 10,000 units, there's never been any documented toxicity. Let's look at the pharmacokinetics just a second. Big word, not a complicated concept. Really, what this says is vitamin D is moving around in the body. It goes from here to here and gets worked on, and then from here to here and gets worked on. And there are controls which are going to turn this up or turn this down. And actually, vitamin D is different from every other steroid hormone. For every other steroid hormone, the level will reach a point where there's some negative feedback, and the process that made that steroid hormone gets turned off. It's like you're turning up the volume, and eventually it gets loud enough, you want to turn it back down again. That never happens for vitamin D. Basically, the liver and kidney enzymes that are activating vitamin D operate below the constants throughout the full range of substrate concentration. So what that means is you don't see any of the that just plain vitamin D in the bloodstream. It's always converted right away into 25-hydroxy or that calcidiol. You never find it until you get levels all the way up to 40 or more, and that's when it can begin to be stored. And what that means is the need for vitamin D is so great that all the vitamin D that the body can get is activated and used as quickly as it's absorbed. So if I'm going to take vitamin D supplements, what kind should I take? Remember, vitamin D3 is the one that's naturally occurring. That's what you make in your skin. It's a nutritional supplement. You do not need a prescription. And you can get it from retailers out there at the health food store or at Walmart, and from internet suppliers. Vitamin D2, if you get a prescription from your doctor, it will probably be vitamin D2, even though it says vitamin D3. I had this happen with my father. He had a very low vitamin D level, and they checked the appropriate level. They prescribed him vitamin D3, 50,000 units a day for 2 weeks. He went to the pharmacy, came back. I opened it up and looked at the package insert, and it was, sure enough, vitamin D2. It was named Maxi D3. That was the name, clever marketing, but it was actually vitamin D2. So the safest thing to do is actually run to Walmart. Vitamin D2 is weaker. It's not naturally occurring, and it does create some metabolic byproducts which aren't natural. And vitamin D2 has been associated with toxicity. In my opinion, it should, if it has to be used, it should only be used under physician supervision. So let's look at the toxicity of D3. There's a question that after chronic daily consumption of 40,000 units, you may begin to see some toxicity. And how do we know what toxicity is? You can have a high level, but that doesn't mean you've got a problem. You've only got a problem when that high level has caused your body to have too much calcium, and you're having problems from that calcium. So when people say, well, I was vitamin D toxic, Dr. Mercola would go, actually has been on his website and said, I was vitamin D toxic. But I think he's stopped saying that. I think he's got a little bit more information now. We know that just having a high level doesn't mean you have a problem. Having a high level isn't a problem unless it also made your body create a high calcium level, which then caused problems. Basically, the only toxicity of D3 has been due to labeling errors, dosing errors, or faulty production. If people were taking 10,000 units or less, they were fine. There was an episode where a product called ProLongevity was created. It was actually mislabeled, and there was someone getting about 2 million units a day for 2 years. Didn't have any problems. He wore sunblock, stopped taking it, wore sunblock, and he was fine. There's a question, what if I take supplements and I get out in the sun a lot? There's never been any reported toxicity from that. D2 we know is toxic. It's less effective in humans, more effective in rodents, and that's why it's a rat poison. Definitely associated with toxicity in the medical literature. There is a condition called vitamin D hypersensitivity. It's not an allergy, but what it says is if you get enough vitamin D, it's going to unmask other problems, and you may have a high calcium level even though you've taken maybe only modest amounts of vitamin D. Certain disease states are going to cause that overproduction of that calcitriol, the activated one. One example is when the little glands that sit behind the thyroid, called parathyroid glands, when they just start acting up and sort of go rogue or renegade and do their job all the time, that may raise the calcium level. And if you're getting extra vitamin D, that may precipitate a problem there. Granulomatous diseases like sarcoidosis, which is it's a situation where the lymph nodes grow very large. We actually don't know why this happens, although I have an idea. And they will overproduce this calcitriol to the extent that the calcium levels will get too high if you give these people vitamin D. There are also certain cancers, they may be metastatic to bone, although this doesn't always happen. But cancers that are metastatic to bone may be associated with increased calcium levels if you give vitamin D. Also, oat cell and non-Hodgkin's lymphoma may have trouble with that too. Now, this is fun. There are some drugs that alter vitamin D levels. The things you learn when you're doing the research for a topic. There are a couple things that raise vitamin D levels. Not a lot, but some. And the statins are on the list, as well as thiazide diuretics. Almost every combination blood pressure medicine seems like has hydrochlorothiazide in it as well. But both of these will raise levels, usually less than 10 points. We're looking at maybe 5 to 7 to 8 points, but they actually do elevate the vitamin D levels. There are other things that are going to lower vitamin D levels. Some of the anticonvulsants, steroids will, cimetidine, medications to treat tuberculosis, theophylline, orlistat, an obesity drug. All of these may lower vitamin D levels. There are certain things that we talk about having drug-raising and lowering effects, and we have no idea if they have effect at all. Grapefruit juice, erythromycin, psychotropic drugs, and cardiac drugs. Vitamin D may have some effect on some other drugs. The calcitriol, that activated vitamin D, actually turns on the cytochrome P450 enzyme. That's one of those enzymes. It activates some drugs like Lipitor. Lipitor works better if people have a higher vitamin D level. And it may deactivate some other drugs. It's a long list. That's a different topic, but it's interesting that it has that effect. So can we use vitamin D to treat diseases? Well, that's just a problem. We know there's an association of low vitamin D with many disease states, but there aren't great data for using it to treat disease. This is why I always fall back on just optimizing the system. But there are some things we need to talk about. There's a lack of randomized control studies, but things we think might get better, we infer by mechanism. The epidemiology may imply that vitamin D may help the situation out. Many trials are out there. They're open trials, and people may draw conclusions that may really not be appropriate. Vitamin D at this point in time is not considered a standalone treatment for any disease state, with the possible exception of rickets, and even then I guarantee you're going to be taking calcium supplements. There we go. So for fun, let's look at the impact on infectious disease. There are anecdotes of people saying this. I've run into many people who've reported this. 2,000 units per kilogram of body weight for 3 days may treat viral respiratory infections. Now, I don't think there's been a study done on that yet, but there are enough people walking around doing it. So, for example, if I weigh, just ballpark, 150 pounds of 70 kilograms, something like that, I would take, 2,000, about 140,000 units. Well, I'm just going to take those 50,000 capsules. I'll take 3 of them. Do that for 3 days, and people are reporting improvement in treatment of viral respiratory infections with that. But there has been a trial. This was a randomized controlled trial done in Japan where they used 1,200 international units a day. They supplemented school-aged children. There was a placebo control. I mean, this was blinded, a good study. and they found that the children had much less flu. They had actually less than half the flu, and greatly reduced asthma attacks. So that's valuable information, I think. And this is not that much, 1,000, 2,000 units a day. This is, again, a very safe amount for children. Cathelicidin is a family of genes that are upregulated by vitamin D. And what's fun is they produce a powerful antibiotic by the infection-fighting cells. That's why that's where part of this 2,000 units a day for the first sign of cold for flu hasn't been proven, but there's a whole family of antimicrobial peptides. The cathelicidin family is just one of them. Just for fun, there's something else called the NOD2 gene. This is something that warns cells about invading bacteria and stimulates something else called beta-defensin 2, which is another antimicrobial peptide. And then actually encodes an antimicrobial protein. I mentioned cathelicidin. These are all upregulated by vitamin D. If you don't have the vitamin D around, your body isn't able to produce these things and isn't able to fight off microbes as well. These antimicrobial peptides actually inhibit the HIV virus. So, for example, HIV has been around a long time now, and it's universally fatal, except for there's prostitutes in equatorial Africa where this whole thing started who are still alive 30 years later. This may be a direct effect of vitamin D. We don't know, but it's interesting to think about. These antimicrobial peptides also kill things like pneumococcus. That's the germ most commonly associated with pneumonia. Meningococcus, that's the one most commonly associated with meningitis. Group A strep, that's the one that you get strep throat from, or sometimes impetigo, a skin infection. These are all sensitive to the antimicrobial peptides. They are produced in many tissues. I thought they were only in the infection-fighting cells, but they're produced all over the place. The skin cells, mast cells in the skin, also macrophages, neutrophils. They're secreted in milk. It probably would be its own talk by itself, but all of these things, again, are upregulated by vitamin D. When I say immunomodulatory role, means we want the immune system to work, but we don't want it to just make a mess. We want it to clean things up too. So the antimicrobial peptides also help the body clear infections. They're going to alter the gene expressions in the host, act as chemokines or cytokines. These are basically cell messengers, or induce their production. They actually promote wound healing. Any of you know if you've got chronic inflammation, you tend to have these chronic wounds that don't heal very well. Again, this may be something with vitamin D that we can help promote wound healing. Inhibits lipopolysaccharide-induced inflammatory cytokine. Okay, I'm sorry. When you have a bacteria, a gram-negative bacteria, and it causes septic shock, that's what this is talking about. Those antimicrobial peptides want to block that. And best of all, the antimicrobial peptides don't induce antibiotic resistance. You may not realize this. Most of the antibiotics I can write a prescription for, the germs in your body, as soon as they see that drug, are trying to become resistant to it. It's actually making them become resistant to it in some ways. And these antimicrobial peptides don't do that. Moving on in the immune system, look at the impact on autoimmune disease. So remember, what's the list of autoimmune diseases? Type 1 diabetes, that's juvenile onset, okay? Rheumatoid arthritis, multiple sclerosis, lupus or systemic lupus erythematosus or SLE, inflammatory bowel disease, both of them, Crohn's and UCs. There are others that vitamin D may have an impact on. It's not clear yet. Thyroiditis, both Hashimoto's and Graves' disease, vitiligo, narcolepsy is actually now accepted to be an autoimmune disease. These all may be impacted. So how is that? So vitamin D actually affects the growth and differentiation of dendritic cells, T cells, and B cells. With the proper amounts of vitamin D, those things are going to be correctly regulated and not attack the human body. So let's look at the scourges of modern man. It's a long list. These are in no particular order. We've got cancer, heart disease, autism, osteoporosis, stroke, diabetes, and in this case I'm talking about type 2 diabetes, chronic pain, and fibromyalgia. Off we go. Let's look at heart disease first. It's the #1 killer in the industrialized world. It's important. And this was fun. For some of the statin drugs, you remember I said it raised vitamin D levels? Well, you got to have a certain vitamin D level in order for Lipitor to even work. And that's interesting. It has to be above 12, which is an extremely low level. But again, I'm here in ostensibly sunny Alabama, and I've now encountered, I've probably checked less than 15, but all of them were low, vitamin D levels, but all of them were low, and I've seen 3 that were less than 12. So supplementation with 800 units of vitamin D, and again, this is a very low amount. It's above the USRDA, but again, a very low amount compared to what we've been hearing about earlier. Plus Lipitor, reduced cholesterol and LDL level 12 to 15 points further than Lipitor alone. The cardiovascular associations, we know that we have, as we get closer to the equator or at higher latitudes where there's more sunshine, we have less high blood pressure. We know we have more heart attacks in winter, especially at the extremes of latitude. We know there's a higher risk of death from heart attack in the winter and at the extremes of latitude, again, where there's less sunshine. And when we actually do the epidemiology and check the vitamin D levels, we find the same associations with the lower vitamin D levels. So the lower the vitamin D level, the worse things are. What are the cardiovascular effects of vitamin D? There are receptors that are extremely sensitive to vitamin D, both in the lining of the blood vessel, that's the endothelium. There's a 1 cell layer thick. It lines every blood vessel in your body, 100,000 miles of it. And as well as the vascular muscle cells. It's going to activate that storage form to calcitriol right there in the tissue. It doesn't have to wait for the kidney. It has nothing to do with calcium level. It has to do with the effect that that tissue needs right there. And that actually inhibits the muscle cells from getting big and thick and stiff, so it's going to maintain the flexibility. We talk about hardening of the arteries, and it's not just that plaque got laid down, and it's not just that there's calcium buildup in there. The blood vessels themselves actually get thick and stiff and not so much flexible, but more, like a thick rubber hose. And the vitamin D is going to block that. It suppresses a peptide that we see a lot in heart failure that makes people hold on to a lot of extra fluid that they don't need. It encourages prostacyclin, which is actually going to prevent clots and the stickiness of those cells. And because we know what happens in heart attacks, for example, is things that perhaps a little plaque ruptures, and a blood clot forms right there and blocks off blood flow. And that blockage of blood flow causes a heart attack. The prostacyclin helps turn down that stickiness and turn down the tendency to clot, so that's less likely. Calcitriol is also going to protect against the calcification of the arteries itself, just like that calcium score you might get for your heart. The vitamin D blocks that, okay? And it's also going to protect against hypertension, stroke, and heart attack via effects on the renin and angiotensin system. Obviously not the forum for that conversation, but just to understand, vitamin D, you've got to have vitamin D in order for your vascular system to function optimally and to keep it young and even make it young again. So I love what the experts are saying. If you've got someone with hypertension and you're getting their vitamin D level optimized, be prepared for the low blood pressure, okay? And then you have to know what to do with it. And the answer is you don't change the vitamin D, you lower the prescription medication. Let's look at stroke. We know that people with vitamin D levels below 30 nanograms per milliliter have a higher incidence of stroke. And we know that the effects may also extend because of the protection against hypertension, diabetes, and atherosclerosis, which lead to, predispose to stroke. And in rat models of stroke, we know that vitamin D is actually protective of the neurons. Cancer, this is fun. It's actually easier to list the cancers that aren't affected or made more likely by a low vitamin D level than read the list. But all your favorites are on here: colon, prostate, breast, lung, pancreas, stomach, esophagus, mouth, gallbladder, larynx, uterus, cervix, ovary, kidney, bladder, rectum, Hodgkin's and non-Hodgkin's lymphoma. So what's not affected, and it's worth mentioning, most of the brain tumors don't seem to have any association with vitamin D levels. The leukemias don't seem to have any association, and your sarcomas or connective tissue tumors don't seem to have any association with vitamin D levels. So, cancer. We know that the season of diagnosis has a survival effect on Numerous. Okay, it's supposed to be numerous cancers. The people diagnosed in the summer are going to live longer than the ones diagnosed in the winter, where their vitamin D levels are lower. We know that the recurrence-free survival in early-stage non-small cell lung cancer was the highest. The people with the highest vitamin D input, had double the 5-year recurrence-free survival of the lowest. And that's huge. When you're talking about double in anything that has to do with cancer, that's a big difference. The Nebraska study really hit the airwaves, I think, and made a lot of people sit up and take notice, at least for a moment. This was a 4-year randomized control trial. And what they did is compare just 1,100 units of vitamin D plus calcium compared to calcium alone, compared to placebo. And it basically found that people taking placebo, and this was several thousand menopausal women in Nebraska, where you don't get any sun in the winter. The risk of cancer was 7% in those taking placebo, cut down to 4% in those taking calcium, and down to 2% in the vitamin D plus calcium. And this is not very much vitamin D, but it made a tremendous impact there. Diabetes. Now this is fun. We'll talk about type 1 diabetes here. The Finland birth cohort study, we got a lot of good information out of that. You can do a lot of things in Finland that we can't do in the U.S. They don't move around as much as we do. So you can follow people for 30 years and find out who's still having trouble. In the 1960s, they decided that they were going to supplement or not. And the babies that were supplemented with 2,000 units a day had an 80% lower incidence of type 1 diabetes. And this is an effect that lasted 30 years. We know because that's when they published the study. That is earth-shattering. Finland has the highest incidence of type 1 diabetes, so they were very interested to see if they could make an impact with that. If we talk about type 2 diabetes, that's the most common. That's our current epidemic. We know that vitamin D has a role in insulin sensitivity as well as insulin secretion. And the experts are telling us, as you're optimizing the vitamin D level, the glucose may initially worsen, but be ready for the hypoglycemia, because as the body gets geared up and learns how to deal with that vitamin D, the levels may go down. Again, lower the prescription medications, not the vitamin D. You want every system in the body optimized. We also know from an epidemiologic standpoint that lower vitamin D levels are going to correlate with a higher risk of type 2 diabetes. Let's move on to the brain, because this is really fascinating. What goes on in the brain with vitamin D is it actually tells the brain to make more of an enzyme called tyrosine hydroxylase. And what that is the enzyme that your brain uses to make catecholamines like dopamine, norepinephrine, and epinephrine. Think of these as the happy neurotransmitters, okay? These are excited and happy and alert neurotransmitters. We also know vitamin D supports neuron growth, and it stops undesirable nitric oxide. Now, I've given talks on nitric oxide before. When you've got it in the blood vessels and it's helping them relax, and for there to be good blood flow, it's a good thing. In certain areas in the body, in certain situations, you don't want nitric oxide. The brain is one of them, and so the vitamin D actually blocks that, and it actually helps to increase glutathione levels. So vitamin D actually helps improve the brain's detoxification systems. Vitamin D has been used to treat seizures. This is an old study. This is the 1970s, but it was pretty well put together. What they did is take a series of children that had really bad seizures. They had 1 to 5 seizures a day, sort of a thing. And they postulated maybe it had something to do with their magnesium levels and their calcium levels. And they thought, well, let's see what happens if we give them vitamin D. And they were using vitamin D too, but it has enough of a vitamin D effect that they actually saw a significant reduction in the seizures in the epileptic children. But it wasn't associated with the changes in calcium or magnesium. I don't know if we yet know why there was an improvement here, but it's important to know. Schizophrenia, back to the Finnish birth cohort study. Among those getting 2,000 units a day, the relative risk of schizophrenia is 0.2. That's phenomenal. That basically said that cut the risk by 80%. That's one way to think of it. Among those who had rickets, which we know is a severe vitamin deficiency state, the relative risk of schizophrenia, who had rickets as a child, the relative risk of developing schizophrenia as an adolescent or adult was 3 times higher. So there are certain things that we know are associated with mental illness in general, whether we're talking about schizophrenia or other situations. Osteoporosis definitely is. Well, no surprise, many of them, if it's bad enough, they're housebound or institutionalized. There's a diabetes association, heart disease, hypertension, multiple sclerosis, and rheumatoid arthritis. These are all separately and independently, that's what I'm trying to say, correlated with mental illness. Let's look at the effect on depression and mood. This study was done in people who didn't even think they were depressed. They gave them 400 to 800 units a day. This is randomized placebo-controlled trial, okay, daily for 5 days, and they report on a self-questionnaire. The ones who were getting the vitamin D were reporting an improvement in mood. It's actually been studied 100,000 international units as a one-time dose orally, improved depression scales better than light treatment in seasonal affective disorder. And the increased level correlated with mood. In other words, the people with the most increases in their vitamin D level had the most improvement in their mood. Back to autoimmune diseases. Multiple sclerosis. Multiple sclerosis is a situation where the immune system is basically attacking the sheaths around the nerves, and the nerves can't work properly. And it's nerves all over the body, including in the brain. It's not a big study, but 12 patients with active multiple sclerosis received 4,000 units a day, increasing to 40,000 units a day, and their storage levels of vitamin D rose from 31 to 154 at 28 weeks with no abnormalities of calcium. It's important to know. They weren't toxic. They just had a high vitamin D level. And the lesions per patient decreased from almost 2 to under 1 at the end of the study. Again, I got this off the Vitamin D Council. They were wondering if 10,000 units a day might have been safer and just as effective. Let's look at autism. Autism is characterized by social withdrawal, some language limitations, brain inflammation, we know, and varying degrees of immune dysfunction. No single cause has ever been identified, and certainly no cure, although a number of people using multifaceted, again, optimizing all the systems, have seen phenomenal improvement. Some kids can't even lose their quote, lose their diagnosis. In other words, you look at them and they're not autistic anymore. The association, oh, this was fun. The CDC put out a list of autism, sort of like, not the prevalence, but it was sort of a survey of states, and what was the incidence. The incidence actually is highest in New Jersey, which was the northernmost state studied, and lowest in Alabama, which was the southernmost state in the survey. We also know from other studies that the highest incidence of autism is in babies born in March. I should have said born in March, at the end of the winter. So they're going to have their lowest vitamin D levels. So what does vitamin D deficiency actually do that might be associated with autism? It's going to disrupt 36 proteins involved in mammalian brain development. If it's severe in rat studies, the rat pups actually have increased brain size and enlarged ventricles, which is something that we see. That the chambers inside the brain are actually larger. It doesn't mean they have a bigger brain. It means there's more fluid in there that's actually, you can think of it as, it's not functioning, it's just taking up space. And that's something that we may see in autism. Children with rickets may have certain features that can be associated with autism. They have flabby muscles. They may be socially withdrawn, and that resolves when treated. Calcitriol downregulates the inflammatory cytokines in the brain that are associated with autism. Remember, autism, they have brain inflammation. Vitamin D sort of turns that down. Vitamin D or fish consumption during pregnancy reduces autistic symptoms in the offspring. And we also know we've got more autism in urban areas, high latitudes, polluted or rainy areas because they've got less sunlight. There we go. Other observations about autism that may be associated with a vitamin D effect. Male is much greater than female, and this is supposed due to the different effects of estrogen and testosterone working with vitamin D. Falling vitamin D levels due to sun avoidance also seems to coincide with the increase in the incidence of autism. We know that autism is more common in identical twins than in fraternal twins, so they're going to have similar vitamin D levels and similar metabolism. And African Americans who have dark skin are going to have a higher incidence than Caucasians. While they're blocking vitamin D production, they have a lower vitamin D level, so the autism incidence may be higher there. So if we do studies on vitamin D and give it to rats, about a year ago I went to the Autism One conference in Chicago, and one of the things I was blown away by is it's very easy if you get the systems off in these newborn animals, any of the systems, the antioxidant system, vitamin D, inflammation, any of these systems is off, you can get these abnormal behaviors in the animals. I was really struck by that, how sensitive the brain is to really any abnormality in the mom or in the in utero environment. Anyway, so if you got a vitamin D deficient rat, you'll give birth to pups with abnormal apoptosis. That's that programmed cell death. That's when cells are finished doing what they're supposed to do and they're supposed to die. Well, that system is broken down. Abnormal brain cell proliferation, it just isn't working right. Reduced production of proteins involved in nerve structure, that means their brains aren't growing properly and they're not going to make the right synaptic connections. And subtle abnormalities in both learning and memory. So there are a lot of associations, I guess I should sum all that up, between autism and vitamin D deficiency. The most important thing to do, it appears, for children is to have vitamin D sufficient mothers. So while mom's pregnant, she's got plenty of vitamin D floating around. Once the baby's born, you can still have an impact, but I think while mom is pregnant, that's the most important time. So let's look at osteoporosis and falls. There's an obvious association there. You can't have normal bones if you don't have normal vitamin D. It's not surprising if you don't have normal vitamin D. The bones are going to be weak and brittle. But this is fun. The bone density is linked to vitamin D levels. But you may add vitamin D to the system and may not change the bone mineral density very much. But you do reduce the fractures, and that's now been linked to the decrease in falls. Vitamin D supplementation reduces the episodes of fall. And the number needed to treat, this is a valuable piece of information. To prevent one fall, you need to treat 15 people. That's a pretty good number. That's close to what we get with antibiotics. To prevent, one death from pneumonia, we need to treat about 11 people. Those are good statistics. If you look at the cholesterol data, the number needed to treat to prevent one death is closer to 100. Those really aren't great numbers. Chronic pain. There have been many studies looking at chronic pain. Not all of them are good, unfortunately, but some of them are pretty suggestive. And there are a number of, strong case associations. So you can't say, well, it's good for everybody with chronic pain or chronic low back pain or chronic pain syndromes. But you can say, if we can get their vitamin D optimized, this may get them out of the woods and some other things may work better for them. A number of failed surgeries. There's an article, I think I've got it in a reference list, and some of the people had improvement, some had complete resolution of their pain, even though their vitamin D levels only increased to 30, which is not what we would consider optimal anymore. We would like to see them closer to 50. Fibromyalgia. According to the American College of Rheumatology, fibromyalgia is diffuse persisting pain. Boy, that narrows it down. There's some conflicting data regarding associations, but anecdotes abound. There are many people, you could get on the vitamin D website right now and find people who searched for treatments for their fibromyalgia for years, finally got their vitamin D levels optimized, and now don't have fibromyalgia anymore. And lastly, let's look at sexual function. In rats, this is a Japanese study, they actually found that vitamin D accelerated sexual function. I should have said it actually helps if the animals have been castrated, their ovaries taken out. It actually prevents the atrophy of the uterus. And the effects of estrogen are enhanced by vitamin D, which comes down to many people now are saying, Dr. Joe didn't really get to say this, but he had a number of women who were having climacteric symptoms too. They were taking 50,000 units a day and said, I'll break your arm if you ever take it away. I feel great. I've lost weight. I'm not having any of those problems anymore. And that seems to be a direct effect of the vitamin D on various sexual organs. And then he mentioned the study that's, he said it was actually refused by the Journal of Sexual Medicine, but genitalia growth of 10.4% with 50,000 units a day of vitamin D. So I think that's about the end of what I needed to share. Few resources, again, vitamindcouncil.com. Also, Dr. Cannell and Hollis collaborated on a wonderful article, It's the Use of Vitamin D in Clinical Practice. Why I put the hyperlink there on a slide, I don't know. It's probably not of any use to you at all. If you Google, probably if you put it in quotes and Google that, use of vitamin D in clinical practice, you'll be able to draw that right up. And then we mentioned, there are things that you can do for yourself. On the internet, you can find vitamin D sprays from 1,000 to 5,000 units per dose. And also you can buy vitamin D3 capsules between 5,000 and 50,000 units per dose if that's what you desire. Laboratory, the cheapest lab I've found to get your vitamin D level, and they'll do the proper level, is zrtlab.com, and it's just $75. They send you a kit. You take it out, you wipe your finger with alcohol, do a little pinprick, and drop the blood on the little circles, and mail it off to them, and they will check your vitamin D level for you. If you have to pay for it yourself at a laboratory, it may run you $100 to $150, I think. But that ZRT lab is the least expensive one that I've found. And I think, yep, that's the end of it. I guess I'll turn it back over to you, David.
Okay, Doc. Wow. Wow.
You just like me because I talk fast.
I like you because you give a lot of great information. This is great. Thank you so much, and thank you for having Dr. Joe on as well. That also helps to bring a perspective of actual clinical practice and application in clinical practice. And that's great. That was great. All right, I'm sure we have a lot of questions. I can see some already. Oh, are you handing it back to me? Okay.
Yeah, I'll hand it back over to you.
Okay, hang on. All right. Oh boy. Let's see. Let me make sure I have my slides up properly. Okay. Folks, if you're on, just if you have any questions, go ahead and type them in. We will get to them as soon as possible. Let me just make sure I have everything, have the slides on properly. Okay. Are you seeing my screen by any chance?
No, but I may not have the right thing up here. There we go. I think I see your screen.
You see my screen? Okay. All right.
I
So
see. Has it got me on it?
You see all the slides?
No.
Do you see it now? Hang on. Let me make sure. Okay. Well.
Let's see. I can't close out too much of this because I may turn myself off.
That's fine. No, we don't want that. So I think.
There we go. There we go. There we go. Now I see you.
Okay.
Now I've got your screen.
Okay. Good. Great.
That's me. I don't look like that anymore, but that's me.
Well, that's why we should have you on a video next time you're on. So
okay.
I tell you, that's a new webinar feature we've been experimenting with. All right, folks, you have been treated to a masterful presentation on vitamin D. I doubt if you ever hear any something like this, except of course you pay like $500 to attend this. But this has been really good. If you have any questions, please go ahead and type in your questions in the chat box to the right of your screen, that floating panel. I have a few questions of my own. Vitamin D2 versus vitamin D3. Isn't that kind of criminal, masquerading D2 as D3 and selling it from the pharmacy? I
don't know. I just think they got away with some really clever marketing. The name of the product is Maxi D3. It just happened to be vitamin D2. If you know what you're looking at, and most people wouldn't check. Certainly not most physicians. I mean, my father's a brilliant man, but he doesn't know. So I just think it's just some very clever marketing on their part.
So if the label says D3, how do people get it right then?
Well, I guess I could have given that. D2 is, I don't know what the chemical formula looks like, but I know the name of it is ergo calciferol.
Okay.
And D3, again, I don't know what the chemical formula looks like, but I know the name of it is cholecalciferol.
Mm.
So when I looked at what it actually was, I mean, under the chemical formula, it gives you the name of it. and said it was ergocalciferol. It's not, it's not the end of the world. I mean, at least he's under a doctor's supervision, but I got him the right stuff. Doing my homework for this, I ran into the article Dr. Joe mentioned, using high doses of vitamin D to treat tuberculosis in the early 20th century. There was an article in Chest in 1946, back before you had anti-tuberculous drugs. I mean, we kind of had sunshine in operations. That's sort of what we had. But they would, for some people that were inoperable or had these, just terrible, just things eating their chest wall away, that sort of thing, they would actually inject the vitamin D into the pleural cavity, 100, 200,000 units, just injected in there. And they'd even use it intravenously. This was before they had institutional review boards and and panels and things, but they would just inject it in there, and we're getting results from people. They found that within days to weeks, the cavity was sterilized. It just took a while for it to heal. So it could be very effective directly applied. And I think part of that, some of that is that antimicrobial peptide situation that we're talking about. What goes on in a granuloma is there's all these infection-fighting cells that are going nuts trying to fight the infection, but they can't seem to get the job done. And it may have been just as simple as they needed vitamin D to turn on the genes so that they were producing the right peptides so they could kill off the invaders.
That's a good point. That's a good point. Now, you mentioned something about storage, and I wasn't sure what units you were referring to. When you say 12, it is stored. Are you talking about 12 international units?
Nanograms per deciliter. I'm typically referring to the American system.
Okay.
When a lot of the medical literature, they'll do nanomoles. They'll do the metric system. I guess I made it convenient for me. Sorry about that.
Well, I grew up with the metric system. I'm sure some of our Australian viewers too were not sure exactly what you were referring to. So it is administered in international units, but it's stored in nanomoles per deciliter. Is that what you're saying?
Yeah. Now, I could give you the conversion. Can I remember the conversion? 1 international unit is 25 nanograms. I think that's right. So let's see if we can make this easy. I have to. It's hard enough for me to remember. Let's see. You have the controls. I'm going to open my Word document. See, I can't remember it, so I have to just keep it.
Okay. Well, don't worry about it then. I mean, I'm sure nobody wants to really know that. I'm just being a geek about this.
Oh. Yeah, I guess some of our. Here we go. No, vitamin D equivalents. Please. Here we go. Yeah, I had to make it up. I had to, make up a document for me. Yeah, that's right. 1 unit is 25 nanograms. So if I say 10,000 units is, add a 0, 250 micrograms. So if I say less than 10,000 units a day has never been associated with toxicity, then that's less than 250 micrograms. Or 0.25 milligrams has never been associated with toxicity. Does that help?
Sure does. Sure does. Okay. Okay. Great. Thanks. All right. Last question. Well, from my point, there are lots of other questions. Dr. Steve Sumney was on. I think he had to leave, but he said, "Great presentation as always." As usual, Dr. E. I guess that will be you.
Thanks, Steve.
And I just want to say thank you for this. This was all news to me. And that's Regina. She mentioned that before she left. Question: nitric oxide is not good in the brain? I thought it was a neurotransmitter as well as.
Yeah, it can be a neurotransmitter. There are many phases of nitric oxide. There's a good side and a bad side to it. If you go back to your chemistry and you actually draw it out, you'll find there's an unpaired electron in there. And that can be a problem depending on the other things around. That's why, for example, when I want to optimize the nitric oxide in someone's particular situation for their vasculature, I tell them you have to have some antioxidants on board. You have to take antioxidants too to prevent any negative effects or any oxidation damage. Nitric oxide has been implicated in the damage associated with all sorts of Again, I can't necessarily call any to mind, but it's let's just say there's a dark side to it, just like there's a dark side to oxygen, and that's oxidation. There's a dark side to nitric oxide, and you know, there's even someone's even got a video out there of you know, concerned about arginine because of nitric oxide stress. But when you get right down to it, it all comes down to oxidative stress. The problem isn't nitric oxide stress; it's really still an oxidation problem. So I probably talked too long around that, but the bottom line is you want nitric oxide where you want it, but it can do damage if it shows up in the wrong place. I mean, multiple sclerosis is one of the examples. It just dawned on me where nitric oxide actually seems to be one of the problems. Now, does that mean they shouldn't take arginine? No, actually, we've seen some phenomenal results with people taking arginine who had multiple sclerosis, because the arginine's made in the right place, and they're going to be taking with antioxidants, so they're not stressing the system. They're giving the system everything that it needs to get the benefits. Does that help?
Sure does. Sure does. Okay, I'm just going to start with some questions, quite a few of them. So, Doc, just let me know when you're absolutely tired and you're fed up, and then we'll just break from we'll just cut it off there. But there are lots of questions. And folks, by the way, we do have a Facebook page, and so we do carry on some of these discussions on our Facebook page, and we are going to be having a blog on our website as well. So some of our presenters, and Dr. Elizabeth too has been willing to do this, can go after the presentation. They can go back to the comments that have been posted, and they can answer some of those questions there as well. So instead of emailing us, you can actually go to either our Facebook page or on our website, and you can actually participate in discussions post-webinar. Okay. Do doctors check their patients for vitamin D levels before giving them Lipitor? I doubt it.
No. Yeah, typically no. Although, you know, there's a growing awareness, I think, among physicians that vitamin D is important. Most important, of course, there's a grassroots awareness among patients that vitamin D levels are important, and the patients are making the doctors check, which that always makes me happy. It's much easier to educate patients than to educate doctors. I'm not kidding. It really is. So, you know, when people are out there and sort of everybody knows you need to have your vitamin D level checked, then eventually the doctors sort of get tired of hearing about it and check into it. And I think that's part of what happened with fish oil. People got tired of, you know, doctors got tired of the people asking, what about this fish oil stuff? And we finally asked for some CME so we could learn about it.
Yeah, we've had Dr. Barry Sears do some excellent presentations on fish oils. He's one of the authorities behind inflammation, and he's big on fish oils.
Wow.
Can we check our levels of vitamin D inexpensively? Do you have any labs or anything you can recommend?
Yeah, that was what I listed in the resources. $75. Okay. You go to zrtlab.com, and I can pull that slide back up if you want to hand it back to me. zrtlab.com.
Sure.
And they will. Let's find it. Here we go. You can order it. You can actually have all sorts of things checked. You can check your hormone levels, progesterone, testosterone, all that other good stuff. But of course, you're going to pay more depending on how much you actually, you know, how much you want checked. Here we go. zrtlab.com.
Okay.
And that's $75, and that is it. Let me shrink this down. Okay, I won't shrink that down. Let's try this again. That is the lowest price that I've ever found for a vitamin D level. Now, if you have insurance, you just go to your doctor and say, doctor, order my vitamin D level. You have to make sure they get the right thing. That's that 25-hydroxy vitamin D. And if they order that, then you'll know what your vitamin D status is.
That's good to know. Thank you. Can I just lower my treatment of calcitrol and take lots more calcium and vitamin D to maintain my levels? That sounds like
so. If that's a hemodialysis patient, the answer is no. So let me explain just a little bit. I don't remember if I said this or not. People with liver failure are still able to do that conversion in the liver, but people with kidney failure can't do the conversion in the kidney anymore, and they have to take activated vitamin D. They have to take calcitriol in order to keep their calcium levels what they need to be. But does that mean they shouldn't take any vitamin D? Because now, see, we've got the activated calcitriol, and it's working on the calcium, but what are all these other tissues going to use? How are they going to get any vitamin D? So I think for people on hemodialysis, it's probably important to check both the levels of calcitriol and calcidiol. So you've got everything optimized, so they can have their calcium levels where they need, and every other tissue in the body can use the can use the vitamin D that it needs as well. Does that make sense?
Yes, it does. If you're having a question about that, please let us know. Is a spray more effective than capsules?
Well, that's what he was saying. That's what Dr. Joe was saying, that he had extremely good results with it, and that that he had seen results, especially what he said was in cancer patients that he'd been seeing results very, very quickly with the spray that he didn't see with the capsules. So there is, I ran across an article somewhere, and then I went back to find it, and I couldn't lay my hands on it, but there does seem to be some decrease, it's like almost like the body turns down its ability to absorb vitamin D in certain circumstances from the intestinal tract. So that may be one of those situations, and the spray may be a superior situation.
I wonder if it's absorbed from the mucosa in the mouth.
Yeah, that's exactly the point. So that's what he said. The liquid, if you just drink the liquid, you run into the same problems as you would with the pill. It's not as well absorbed. But putting it in the buccal mucosa, you get all the absorption and much better results.
Right, right. And speaking about absorption in the guts, I mean, this new form of vitamin D called micelinized vitamin D3 seems to be on the market now, and they say that it's more hydrophilic, and so it's better absorbed. Do you know anything about that?
I don't. But I do know what he was saying about the spray was that it's water soluble as well. So that maybe that's a similarity. I don't know.
Mm-hmm. Okay. Would a liquid vitamin D3 of 2,000 international units work?
Say that again. Would a liquid what?
Vitamin D3, 2,000 international units, I guess, per dose. Liquid vitamin D3 of 2,000 international units work.
Well, yeah, work for what? So what Joe was talking about was specifically, I guess, for cancer patients. He was seeing a lot better results with the spray. But sure, I've recommended liquid vitamin D, 2,000 per drop. I've recommended that before for people. Send them to Whole Foods to pick it up because I knew they could get it. And I knew they could get it in their kids because you got to have some way to get it in the kids. It's too important a nutrient to let slide.
Mm-hmm. 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 Here's a great question. Can you get vitamin D from tanning beds?
Yeah, that's a great question. The answer is yes, you can.
I did not know.
The UVB tanning beds. And it seems like Dr. Mercola has a one that he's actually trying to promote and on his website. I don't know all the specifics of it. I haven't looked into the tanning beds too much. But Mercola.com, it's M-E-R-C-O-L-A, Mercola.com, is a great, what am I trying to say, like a reference, like a resource for everything. He has an opinion about everything. I don't agree with him about everything, but he has an opinion about everything and has tried to look into it, whatever it is, before he just spouts off. So if he's actually promoting a product, chances are it's a pretty good product. And it's not, it's going to be non-toxic to you and to the environment, and give you the good things that you want, and not give you the bad things you're trying to avoid. So that's a good resource.
Mm-hmm. Mm-hmm. Yeah, I subscribe to his email too. It's free as well. Is there a connection between vitamin D and gum health?
Yeah, I didn't really get into that. Gums can be affected by a couple of different things. Coenzyme Q10 is one. But also vitamin D, no question about it. There are associations there. There's so many. Joe talked my slides up, but there was still plenty more to say.
How is vitamin D3 and magnesium? Okay, the question is not complete here. All right. The person you answered the question about a kidney dialysis. She says, no, I am not a kidney patient. I am a HPTH patient. I don't know what that means. Do you? HPTH. All right. Well, you might need to help us out there.
Hyperparathyroidism, I'm going to guess.
Could be. Yeah, she did mention calcitrol, didn't she? Or calciferol. I don't know, calcitriol. That's from that gland, isn't it? Okay.
Yeah, so, that's one of those things. That probably would be a question better for Dr. Joe. There's too much to know about hyperparathyroidism. And I don't know it. That really is an endocrinology question.
Well, we definitely need Dr. Joe to come talk about some of his endocrinology stuff too. Some people want to know where you can get the vitamin D3 spray that Dr. Joe spoke of.
Well, let's see. Seems like I found. He told me that the guy's name was Dr. Spray, and it seems like I just Googled Dr. Spray and vitamin D3 when I was putting these slides together, just to get an idea of how much was in there. But I guess another thing you could do is have them email him directly.
Okay. Do you have his email address, or do they need to call his office?
I'm pretty sure it's Dr. Joe at drjoeweb.com.
Okay.
See if I've got that piece of paper here somewhere.
And there are some questions that are too treatment directed, like so. Folks, we tend to discourage some of those because for obvious reasons, obviously. So someone says, are all the D3 supplements at drugstores and Walmart the same quality, or is there one that is of higher quality?
Yeah, that's a good question. I'm not sure that I found one that I'm convinced was really bad. I don't think it's the same as, say, some of your other vitamins or your things like MSM and chondroitin. I mean, I really have seen some significant differences in quality based on where I got it or what form it was. I haven't really seen a big difference there. I think the cholecalciferol or vitamin D3 is pretty much vitamin D3, and it's going to give you the results that you want.
Well, that's interesting because, I mean, there's a very wide variety difference in quality among the other vitamins, like you mentioned. Okay, where is vitamin D3 derived from? I guess she wants to know how you produce, how most people produce the vitamin D3 in the first place.
I guess I can't speak to all vitamin D3s. The one that I'm most familiar with actually is extracted from lamb's wool, and so, which is a lot cheaper if you think about it. It's a lot cheaper than trying to extract it from fish livers or something. So, and it's an animal-friendly. That's going to be an animal-friendly situation. I mean, if you can wear wool socks or a wool sweater, you should be able to take D3. So, I think that's a good choice.
Okay. And yes, the person said yes, that HPTH is correct. She is. That is the issue she's dealing with. Okay. If a pregnant woman is using sun exposure, what would be a safe vitamin D3 level for additional supplementation? I guess she means that the pregnant woman is.
Well, we know that nobody's had toxicity from sun exposure plus supplements. So, I mean, you're still going to say if she's taking less than 10,000 units a day, then she shouldn't be in a situation of problem. Actually, and I know a lot of people who, when they got their vitamin D levels up, stopped sunburning. So I think
Wow.
having a vitamin D level that's higher may actually have an effect on the way your body processes the sunlight.
Well, that's interesting. No. Would there be an adverse effect for people on dialysis or who are in stage 4 renal failure?
Yeah, then that's the one that Dr. Joe says really should not take 50,000 units a day. But I think they should have access to the vitamin D3 so they can get, like I said, so all their tissues can get the vitamin D that they need.
Okay. And someone just gave us Dr. Joe's email address, so you're right. It's Dr. Joe. It's actually Joe at drjoeweb.com. That's his email address. Is getting sun without oiling up okay?
Yeah. Well, what's okay? Sure. I mean, people do it all the time. People have done it for years. Like I say, there are lots of reasons people may choose to avoid the sun. I don't want to have any more wrinkles or freckles. You know what? You don't want to be in such a situation that you're getting frequent burns, because then we know your skin cancer risk is higher. So those are all things to consider.
Okay, gotcha. I think this pretty much covers most of it.
Good. I'm tired.
Okay. Oh, good. Well, Doc, thank you so much. I know you've been really, really busy, and I've been bugging the life out of you to try and get you back on the webinar. We finally did. I hope this will not be the last one for the year.
Okay. Well, we'll see.
All right. Well, thank you again, and thanks for bringing Dr. Joe.
Okay.
Well, folks, thank you for joining us for the webinar, and we will see you next week. We have a couple of really good webinars lined up for May, so just stay tuned. And if you want to join our email list, just go to our website and add your name there. Remember, Facebook, we will be continuing discussions on Facebook as well. So if you want to, if you have any more questions, just go there. We shall be checking that from time to time. Or you can just send us emails directly. All right, folks. Thanks for joining us again. Have a great night. God bless. Bye.
Good night.